We are live. It's a good morning from this side. Let me know if you can hear me. Let me know if you can hear me. It's a beautiful Thursday morning, live from Lagos, Nigeria. Welcome to the live. Let me know if you can hear me. Hello. Who is first to join in? Let me know in the comments. Let me know in the chat. Okay, welcome. Where are you watching from? I will always ask that question. Always good to know where members of the community and everyone just joining in for the first time coming across the channel, where they're watching from. All right, so let me know in the chat. Where are you watching from? I hope I'm audible. All right, so I believe the audio is good. So what are we talking about this time? I promise this to be interesting, but I want to welcome you all. Welcome to the live. So why are we on at this time? Let's get into the business. How are you doing? Okay, great. Great. Where are you watching from? Welcome, welcome, welcome. Who is here? Who is forced to drop a comment? Welcome to the live chat. Remember to guard your privacy and abide by our community guidelines. So here is my face. If you're yet to know, this is your Dr. Soyemi Damilare. I'm a family physician, streaming live from Lagos. Let me know where you are watching from. So we'll be talking about some very important things this time. So stay tuned, and then please do well to give this live a thumbs up. Double tap on your screen to like the live, and I'm sure that way the system will help more people to join in. Welcome, thank you for joining in. Where are you watching from? Let me know if I'm audible. Let me know if you can hear me. Hello, hello, hello. And what time is it in your location? I hope the lighting is okay by you. Are you okay with the lighting? I hope your screen is bright enough, the video and the audio. Okay, I believe Calvin Kalaba. Thank you, Calvin, all the way from Zambia. It's good to have you here. Thank you for joining in. Kindly double tap on your screen, and then the live will get to reach more people that way. The system recognizes that you like this, and more people can be reached. Thank you, Calvin. Thank you so much, Calvin Calaba. Thank you for the like. Expecting more people to like. And remember to subscribe to the channel. It's about health, wellness, and lifestyle. And I believe this is a very important and common thing to everyone, irrespective of your location at this time, irrespective of your status, irrespective of your gender. health is wealth, and that's one major resource that we all have. It's a gift, it's a treasure, and we must appreciate God for that gift, the gift of health, the gift of life. Okay, so I believe you are alive and well doing this morning. Okay, it's morning on my side, but I don't know what time it is on your side. What part of the day is it? Is it morning? Is it afternoon? Is it evening? Is it night? I believe in the United States, for example, it should be about 2 a.m. or so. So, Calvin, thank you for dropping a comment first, all the way from Zambia. So, what time is it in Zambia today? What time is it at this time? All right, it's 8:29 a.m. Nigerian time, West Africa. So I believe we are in the same zone. And then MMA is here. MMA, thank you for joining in. Where are you watching from? Let me know in the chat. Let me know. Let me know in the chat. And then if you are coming across the channel for the first time, kindly drop a chat, a comment in the chat. Let me know that this is your first time. And then remember to double tap on your screen. Kindly double tap to like the live, and then you should kindly subscribe so that we can get to connect better. We have wonderful members of this community in different parts of the world, people in the United States, people in India, of course, many people in Nigeria, members of this wonderful community. We have people in Germany, we have people in Belgium, we have people in the United Kingdom, people in Canada. Okay, so it's a great community of wonderful people from different parts of the world. Okay, and you find interesting comments, interactions in the community. All right, so I want to appreciate everyone once again for celebrating with me this month. This marked another year for me, beginning of another year, marking my birthday. So I appreciate you all. Thank you for your comments. Thank you for the gifts. Thank you for celebrating with me. The prayers are well appreciated. So this time I want to share with you on why some people refuse to come to the hospital for consultation or for treatment, okay? And especially being World Breast Cancer Awareness Month. I don't know if you are aware of that this month, October, and this 2025 is World Breast Cancer Awareness Month. And the interesting thing is that experiences of people are different, and in terms of whatever symptom that they may have, or whatever started that manifestation of the condition. Okay, and then the road that each person will take when it comes to the management of that condition will usually be different. Interestingly, I usually say this, that even if two individuals, even if they are twins, have the same condition diagnosis, sometimes the way they will be managed most times will sometimes be actually will be different, looking at some factors. Okay, I can see Sazola is here. Thank you, Sazola, from the Philippines. Thank you. I say Tamsak, doc. I hope I know. Can you interpret that in English? What's Tamsak? Sazola, good to have you here. Thank you for the like. What's Tamsak? Kindly give the English version of Tamsak. Is it greetings? Does it mean greetings? Okay, Sazola said hi. Hello, Sazola. Thank you. Thank you for joining in. Thank you for engaging. Remember, you can share this live with your community. Okay, we are talking about something interesting. This is Pinky Month. Pinky Month. it's Pinky Month, and then that's the favorite color for the theme for Breast Cancer Awareness Month. All right, so you've been seeing me wear pink. If you watch some of the previous live sessions, okay, I try to do that, and we've talked about. Okay, I'm going to try this sticker from YouTube. Have you noticed that YouTube has been updating? Where's the sticker? It's disappeared. Okay, maybe another one will show up. Very interesting question. Maybe I'll get to type it now. Let me type. Let me type that question. What's that one bad habit that you have? Now YouTube is making the platform more interesting. Okay, I've dropped that question in the on the screen. Okay, so Sazola says AI. Sorry, doc. Okay, you mean you used AI to generate that? I am not sure. Okay, it means like. Okay, like, doc. Okay, thank you, Sazola. Thank you so much. Okay, welcome, welcome, welcome. So that's something about language. All right. Thank God for the English language. All right. So like, thank you for the like, and then hoping to have more likes, more people to like the live. Trying to adjust to see whether the lighting can be better. All right. Okay. So talking about one habit that you have, that's one habit. Can you drop in the chat? Let's talk about it. Some people say habits are hard to break. Is that true? Okay, so knowing yourself, in fact, knowing what people have said or are saying about you, what is that one habit? One bad habit that you have. All right. Okay, so some people are in the habit of avoiding talking to their doctor. Okay, so for how long are you going to avoid that? Even if it's just for a checkup, medical check, you need to interact with your doctor. The way it is that God has made it possible for us to learn, to have knowledge, and to be able to apply in the management of our health. One of God's commitment to us is his commitment, major commitment to our health, to our living healthy, to our enjoying life, and to be effective and at what we do in life. Okay, so how much can you do with a bad health? How much can you do with ill health? Okay, so we need to keep talking about this. Now, talking about breast cancer, there are a lot of misconceptions. There are a lot of misunderstanding regarding condition, and there are a lot of doctors out there. Sometimes I come across patients who say, "Oh, a friend told me to do this. My mother asked me to do this. My father asked me to do this. You know, a colleague asked me to do this relating to their health." So sometimes I call those people the doctors, doctor in the office, doctor at home, and it's not bad sometimes to actually get recommendations, advice from people around us. Of course, when there are things that will benefit our lives. But do you know that there are certain decisions that you cannot or you should not take, without proper relationship or communication with your doctor. All right. So why do you avoid interacting with your doctor? What are your concerns? What are the limitations to your interacting with your doctor? Some people are actually afraid of a diagnosis. Okay, and interestingly, uh, most of the time, what people are afraid of, some don't actually get to have that diagnosis. Some others have the diagnosis, but if they present early, it's usually attended to early enough. But when there is late presentation, that's where we now talk about complications and trying to limit the progress of the condition and then treat complications, talking about the need for rehabilitation. Okay, but do you know that there are a lot of misconceptions out there, especially regarding breast cancer? All right. People don't really know what it is. Some people assume, some people have used other people's experiences to judge. Imagine somebody having a lump in their breast and then they remembered somebody that had something similar, which actually was a boil and was treated with antibiotics and then some pain relieving medications. The individual, maybe talking about a female now, recovered and is doing well. Okay, so another individual develops a breast lump and now feels that is the same thing, okay, and decides not to present to the hospital to see their doctor for proper evaluation, all right, and then finds out that, okay, maybe this is now a fibroadenoma, a benign form of breast condition that now requires, some kind of management, okay, specific management for that. Another extreme, an extreme is that where the individual actually has a breast cancer which was not discovered early enough. So you need to understand that you should never compare your symptom to the symptom that another person around you has. Even though your doctor will definitely ask questions relating to your family history, if there's somebody in the family that has had a similar experience in terms of symptom, even it could be cough, it could be the swelling that I mentioned. For example, in fibroadenoma, which is another a breast condition which is benign, there is usually a positive family history. But interestingly, one person in the family in a generation could have had a breast cancer, and another generation it could just be fibroadenoma, not breast cancer. Thank you, Sazola, for the interpretation. Sazola says it means light. Thank you. Sazola says love. Thank you, Sazola. Thank you so much. All right. So I believe you're following. Let me know if you can, if you are getting me clearly in the chat. Let me know if you're getting me clearly in the chat. Let me know in the chat. I hope I'm audible. Sazola, I hope I'm audible. Everyone, remember to double tap on your screen to like the live. Remember to double tap on your screen to like the live. Okay. Individual decides to present. Okay. Individual decides to present late. I hope you can still hear me. I just talked about a condition whereby one person had a breast cancer and another person developing a symptom around, thinking that, oh, this is likely to be a breast cancer. No, you don't make a diagnosis of breast cancer by just looking at the breast, okay? Your doctor wouldn't do that. Even though there are extreme cases, there are conditions whereby individuals could have had late stages progression in the condition that could manifest in some physical ways. Okay, but you don't assume that because you have the same symptom with somebody around you, that it's the same diagnosis. So that needs to be clear. So we need to clear that And then the other side, like I was saying, is that somebody has had a benign breast condition and another person having similar symptom like a breast lump or a breast discharge, now assuming that they have the same benign breast condition. All right. So what happens when the person presents late to the hospital, to their doctor? By that time, some could have had metastasis of the cancer, and sometimes that takes more in terms of management. Okay, so that's why early presentation is a very important, a key aspect of management. You know, the cure rate, there's high level cure rate if there is early presentation. However, in late presentations, there are lots of factors, a lot of things that need to come in. All right. So let me know your thoughts in the chat. Let me know your thoughts. So, what are the other conceptions, misconceptions that you know? All right. Okay. So, one of the other things that I need to mention that happens in the people with breast cancer is that they don't want to come to the hospital because they have access to some alternative treatment. Okay, and some of these are unproven. Some of these may not. They don't have science backing. Even without science, people have not done well with some of these things. But the fact that people have access to information, people have individuals, people around them, communities where they share some of these things. Talking about herbal concussion, for example, traditional treatment, you know, a lot of these are available. But the question is, if this is working, why not? Condition that needs to be managed, and then the individual does not um, want to come for orthodox treatment. The question is why? Is it the people around such an individual that are advising such an individual to take some other forms of treatment that's not helpful for them? All right. Some people have had increased progression in their condition, leading to complications and even early deaths when it comes to receiving traditional treatment. This is not to say that there's no room for natural treatments when it comes to conditions. Okay, but these many times are actually supportive. Are supposed to be supportive, and they should not conflict with the orthodox treatment. Do well to subscribe to the channel. If you are just coming across the channel for the first time, I want to welcome you to this L an LD community. Okay, please let me know where you're watching from. Let me know where you're watching from. So that's another misconception and a bad approach to management. Now let me talk about some other specific challenges that people have when it comes to the treatment that they should be having if they have a breast cancer or a breast condition. Another one, this factor is financial factor, and that's the demand when it comes to running investigations. In fact, some people have challenges with consulting with a doctor. They don't have access, and that's where governments, non-governmental organizations, individuals, communities now need to come in to support and make provisions as much as possible, subsidize discounted rates for people who have conditions relating to cancer generally, and even breast cancer. All right, so the financial challenge, the burden in the management of breast cancer is there. And so people tend to want to stay away and go for the cheaper approaches to the management. All right, so that's why prevention is actually better and it's cheaper than cure. Do you agree with me? Okay, so I usually use this example that if an individual is being managed for hypertension, high blood pressure, the individual will necessarily be on medications, do some regular checkups. Okay, but if the individual refuses to take their medications, do the lifestyle changes that they need to do, dietary modifications, such an individual skipping their medications may develop a stroke. And if that happens, some investigations are very important. In your environment, I don't know if it doesn't cost much to do a brain CT scan or a brain MRI, but if you have some settings where these investigations are not subsidized, then such an individual will have to pay more. Apart from doing a brain scan, and many other tests that such an individual will be required to run. So that costs a lot. So thinking about the financial demands, okay, that's why earlier, yesterday or 2 days ago, I talked about the need to support people who are living or dealing with breast cancer. They need a lot of support, not limited to moral support, psychological support, being present, medical support. In fact, they need financial support. So how much of support can you give, to individuals with such a challenge? That will go a long way. All right. So sometimes some people don't know that there are opportunities, there are discounted rates for some investigations when it comes to management of breast cancer. So you need to find out about your the provisions, the available resources, discounted offers for management of breast cancer in your region. Very important. So that's where information is essential. And now let's move to the treatment itself. People know about the need to run some tests, and then some people have the opinion that, this test may even do more harm than good. Okay, so they have those false beliefs. So these are things that also affect. That's kind of a system or mindset is what also affects people seeking medical care. Other challenges include experiences of people with chemotherapy, experiences of people with surgery, experiences of people with radiotherapy. In fact, when it comes to chemo, the fact is that the chemo does not just deal with bad cells, those cancer cells. It also affects the normal cells, and that's why the individual may come up with some manifestations. Individual may lose weight, hair loss, may have some ulcers, and this are not pleasant experiences at all for the individual. So there are people that have recovered well from such therapies, chemotherapy, radiotherapy. Of course, there's a way the medical team handles such in terms of preparing the individual for that kind of treatment, those kind of treatments, talking about chemotherapy and talking about radiotherapy. Even for surgical interventions, there are steps that are usually taken. So if you are relating based on the experience of one or two persons around you, especially when there are bad outcomes, when there have been bad outcomes, then you or somebody that needs proper medical attention may have some fear or limitations in seeking medical attention. So I want to encourage you that you don't base your decision on the negative. Thinking about the negative can get overwhelming. Some people have actually developed some mental health issues when it comes to having some medical conditions. It may even be diabetes, maybe any condition at all. There's a psychological component to these conditions and to the management of these conditions. So if you are going to win if you are going to overcome, if you're going to help somebody around you who has this diagnosis, then you need to help them to seek or to get the appropriate information that's going to benefit their lives. Okay, there are centers that are actually focused on this management. Most of the time, we have cancer centers in different parts of the world. You need to find out in your own region. There are also institutions, that have provisions for the management of people with breast cancer. I don't know if you have any question. Kindly drop in the chat. I believe somebody somewhere has been enlightened and encouraged to do the needful when it comes to seeking medical care. All right. Thank you for joining in. Let me know where you're watching from. Who is here? Sazola, are you still there? MMA Calvin Calaba, thank you for the third like. Yes, who is there? Let me know in the chat where you are watching from and what time it is in your location. I know most of my people are currently asleep. I'm talking about people in the United States, except for a few who will be awake about this time, maybe 2 to 3 a.m. now. All right, so let me know what's your thoughts. What your thoughts are. What's that one bad habit that you have as an individual? I don't know. Would you want to share with us? And maybe that way you can get some encouragement to make the necessary shift. So, what is that one habit? Okay, so let me know if you have any question, any comments, any experience, contribution to this discussion. If you have any question at all, kindly drop in the chat. Welcome to the live. Remember to double tap on your screen to like the live. And if you are new here, please subscribe and be a part of the community. Welcome, welcome, welcome. If you don't introduce yourself, I don't know who is here. Yeah, very soon, hopefully, YouTube will start to show the names of people who are on the live. Okay, even if they don't drop a comment, it's possible soon. All right, so but you can introduce yourself now, and let me give you a shout out. All right, so Sazola has been here. Thank you, Sazola. MMA Calvin Calaba from Zambia. Okay, thank you once again, everyone who was able to join in. Spend about 30 minutes on this live. So I'll see you again soon. Watch out for upcoming video. See you. Bye for now.